I'm Matt Willis, Public Health Officer for Marin County with a status update for March 1st, 2024. Today, I'm going to cover two late-breaking issues from the past few days. The first is the CDC has recommended a second dose of the new COVID-19 vaccine for residents aged 65 and older. And the second is that we're experiencing a cluster of fentanyl overdoses in our community currently. Starting with COVID-19 vaccine. The CDC's Advisory Committee for Immunization Practices met Wednesday and decided that it's time to recommend that people aged 65 and older get a booster of that same vaccine that was rolled out in the fall of last year. We support this recommendation in Marin for four main reasons. Number one, over 90% of our COVID-19 hospitalizations and deaths in Marin are among people over age 65. Number two, people who are vaccinated with this vaccine are about half as likely to be hospitalized for COVID as those that weren't. That even compared to people who had gotten the original vaccine series. So this does add value on top of other earlier vaccines or infections we may have had. Number three, immunity gained from the vaccine or infection wanes over time. If we think of an infection or vaccine as kind of charging up your immune system to fight COVID, that charge seems to last about 6 months. Though there's some wide variability between people. And lastly, our local data is clear that COVID-19 is not really seasonal the way flu is. If you look at our Marin wastewater and hospitalization graphs for COVID-19, there are peaks and valleys throughout the year. The fall flu shot really just needs to get us through the flu season, which ends in spring. But for COVID, we need protection year-round. So if immunity wanes over a 6-month period, an annual fall and spring COVID shot may be in the cards for years to come, but it's too early to tell. Certainly a good idea this year for people aged 65 and older. But stepping back, for us in Marin, the more important point is this. Only 58% of our residents above age 65 have even gotten one dose of that new vaccine. While that's the highest rate in the state, I'm concerned that those 42% that haven't gotten one dose of the new vaccine are at higher risk. So while we support those over age 65 that got the fall shot to get another one this spring, especially if you have other medical conditions, the urgency is highest for those that haven't had one shot at all. Lastly, I recommend treating infection as if it's a vaccine. In other words, if you've had a recent infection, talk to your doctor, but we do suggest go ahead and wait 4 months after infection to get your shot. The spring vaccine will be offered by pharmacies and your healthcare provider the same way you were able to access that fall shot. The second topic relates to the other major public health threat we're facing together, and that's the fentanyl crisis. Since February 14th in Marin County, we've had 5 suspected fentanyl-related overdose deaths. While these are still under investigation, this is about 4 times higher than the usual overdose rate. And we thought it's important to signal we're in a period of higher than usual risk of overdose for people using substances. We're not seeing any particular geographic pattern in this recent cluster of deaths. And preliminary information suggests that people with known risk, as adults who seem to have substance use history, and all seem to involve multiple substances along with fentanyl, including methamphetamine. We also found increases in wastewater concentrations of these substances recently and in 911 calls for non-fatal overdoses. These are the key steps to take. The most reliable way to prevent fentanyl overdose is to not use drugs that aren't prescribed to you, period. At the same time, we know many of us struggle with substance use, and we see addiction in every Marin community. During these intervals of increased risks, it's important to double down on the things we know can protect against fatal overdose. And it's primarily 3 things. Carry Narcan, the nasal spray that can reverse an overdose to opioids like fentanyl. Second, don't use substances alone. And 3, test your drugs for the presence of fentanyl with fentanyl test strips. Visit odfreemarin.org to find locations for obtaining Narcan and fentanyl test strips for free in Marin. Today, we sent a public health advisory to all our clinicians across Marin and substance use counselors and providers outlining the situation and reinforcing these prevention messages. We're also fortunate that that our community response teams, built for pandemic response, are still active and will be busy sharing resources to prevent overdose in our cities and towns. Marin County Public Health continues to monitor threats to our health as a community, whether from infections or substances, and will continue to offer updates to guide the health choices you make every day. Thank you for doing your part.